There was a lot of changes happening. A lot of more unattached patients, which meant your hospital work was no longer representing the continuity of follow-up with your own patients, and of course those people needed care afterwards, and most of us ended up absorbing people who we looked after in a hospital and had nowhere else to go. So our practices were getting more complex with more acuity, and the patients who needed more short-term urgent care were taking advantage of the availability of walk-ins, not just in our community, but we can see it's become a change with urgent care centers. And so family practice was becoming more work, more complexity, more associated paperwork, and morale was failing, I would say. It was a time when people were thinking this could be the end of family medicine.
The problem was that we were really committed to full service family practice, full spectrum of practice, not wanting to see family practice fragmented. And we could see doctors stepping away from hospital. We could see the kind of deterioration of what we felt was the vision for full service family practice, really working together, I think, to meet the needs of the community.
So what would you say is the most important work that we do?
There's still family physicians
Yeah, good
in
point.
White Rock.
That's a good point, Charles.
Yeah, it's strengthened the family practice concept and existence. Like, yeah, family practice is still the hub of care.
One of the things that I valued was diversity in leadership. When I looked around the first board, we all thought differently. We would challenge each other. You know, we didn't always agree with each other.
You were out there, Charles. You were kind of out
Yeah.
No, but it was really.
No, that's very true.
In a good way.
I think that's
Yes.
great observation.
Do you recall when the division took on the recruitment activity? Was it from the beginning?
So that was one of the early things that the division did.
That was, I think, a great boon, a great service with the administrative support, and to make good matches and to sell our group effectively.
You know, I tell the example of having a resident in the United States who's Canadian who wants to end up somewhere, and I say, you're going to White Rock, and I can direct them to a recruit, you know, one of our people, rather than saying, okay, well, go see this clinic or go see that clinic. It's just boom, and it's been really successful.
You don't have to go to the help wanted ads.
Right.
You can just go right to.
Yeah.
Peace Arch Community Medical Clinic. Talk about that, Paul.
So we formed this clinic, which was on 18th Avenue, 152nd, and Burl Gibbings was one, and Grant was involved, Grant Gibbings, and Angus also. So put together our own walk-in clinic. And again, it was more of a reaction to a couple things, one of which is if you want to have a day off, go to our walk-in clinic, and we would make sure that information got back to the GP. That was a really important piece in all of that. It really helped polarize us, I think, as a group. We had this community clinic. We're going to look after you if you're away. We'll help you. Patients are going to be looked after. Go back and see your GP. And so that good communication piece took place. As a community, we looked after our patients, and we want to make sure patients were well looked after, communication to the other physicians, and supporting the same as we did with our colleagues, looking after our colleagues. So again, Connie had mentioned that earlier about how we are very much supportive of our colleagues and our community. So that was just one of many pieces that made us sort of special, I think.
But it was also, it signified the culture shift, that things in family practice were changing, and the sudden appearance of walk-in clinics. And then how do you counter that rival And how do we show that we really care about our community and our docs? And so it was a response to this culture pressure. And so that was, it signified and represents really what the whole community is about. Like, we care for each other, we care for our patients, and we're a very unified collegial group that works together.
We were one of the 3 prototypes for a GP for me as well. And I remember presenting to the physicians about the attachment initiative. And I remember one of our older physicians, because it had been 15 years or so that the family doctors hadn't really been able to accept patients. And they said, so what are you going to do, pull a rabbit out of a hat? And we had intended with a GP for me that maybe within 3 years we might be able to attach everyone. Within 18 months, we were able to say that anybody who needed a family doctor in White Rock, South Surrey could get a family doctor. And that was with a GP for me.
And that was a great project.
Yeah.
It's too bad they dropped it.
Mm-hmm. Yeah, but that was memorable.
Yes, that was very memorable.
Is
I
that
agree.
something you can bring back?
Yeah.
Because I thought it was a great idea,
Yeah.
You were responding to problems at the time, but what were your kind of hopes or vision of how this could, evolve? Or
I think the hope was to reinvigorate family practice. I remember we had a workshop. Remember we created that lovely drawing map of our vision and a path where we were going? We did that.
With the graphic.
Yeah, with a graphic designer. Yeah.
The division as the hub
Yeah.
for family practice for the community. It was kind of the connecting piece, the hospital, the family doctors, and all the other pieces.
Yeah, it was the centerpiece.
So
for
it was
sure.
truly
Yeah,
the hub.
yeah. Does the executive or yourself have a vision of where you would like to see divisions going, or other things that could be offered?
as a division with the primary care network, I think we've spent a lot of, that's taken a lot of our time and energy in terms of building that out, building that team-based care. And I think it's been a great success, but I think the thing that we need to do now is perhaps do a little bit more in the community, so form more community connections, develop better collaborations with, say, sources or other community partners that are doing great work out there, and perhaps are also seeing some of the patients in our people in our community that are, say, vulnerable, that perhaps are unattached, they're not seeing a family physician, or they are attached, but maybe they're not coming to their problems to their family physician. They're going to sources, they're going to Alexandra House. And so, so I think there's, I think the future is creating more collaboration and more, I guess, pathways and networks for that connection to happen. To develop those partnerships with the community, because I think that's one of the great things in our communities. We have lots of great, community partners, non-for-profits, sources, Alexandra House, that have done great work for a long time. So I think to try and value that and to create value in that partnership.
I think it's building on and remaining nimble and adaptive to the times. And like you said, we never had homeless people in the past. We do. How do you address that as a community? I mean, they're looking in the hospital. How do we address that? And it's a challenge. How do you address the mental health, the substance use? We don't have resources to do all of that. And that's where I think the divisions have power, because they can select and say, this is what we need in our community.
The principles of supporting family practice, working together, trying to proactively problem solve versus get together and just complain. The empowerment, like Connie says, the nimbleness. So yes, the landscape has changed. Yes, there's different members. Yes, people practice differently. But those fundamental ideas of working together, meeting the needs of the community, valuing family practice, forging connections with the broader medical community, really trying with specialists and all that the division does to welcome new members and to also recognize members with, the hello goodbye parties and, the awards and all those fundamental things, I think still hold true. And that's where the real power and the value of the division comes.